As I mentioned, those with skin or cartilage at the tip of the nose may see more changes before and after cartilage binding. Hello, I am Lim Jung-taek, Director of Rise Plastic Surgery, where we realize beauty. Many people think that nasal tip cartilage suturing is ineffective or that it loosens and reverts over time. Today we will take some time to look at what this surgery is and who it is effective for. The nasal tip cartilage suturing procedure, as the name implies, involves the two pieces of cartilage at the tip of your nose. You can think of it as a surgery to bring them together to make a bulbous nasal tip look slimmer. The issue is that this procedure does not produce dramatic before and after results, and it is not effective for everyone. For those with very thick skin covering the cartilage, the visible change is bound to be minimal, and if the cartilage inside is too small, thin or soft, the procedure is also less effective. Thus, it is most important to determine if a case will have decent results from cartilage binding. As I mentioned, those who do not have very thick skin and have well-developed nasal tip cartilage may see more of a before and after change, so it is important to first determine if they are such candidates. Also, how the cartilage is bound is a very important point in the surgery. If you tie the nasal tip cartilage in the wrong place, the nose can look pinched. And if it is not tied symmetrically, it can look crooked or asymmetrical. So the surgical technique used is also a key point. This surgery doesn't produce a dramatic before and after change like raising the nasal tip. So, if you want a more striking look or a clear transformation, I recommend raising or defining the nasal tip instead. This procedure is better suited for those who want a subtle, natural refinement of the tip.
Does tying the cartilage make the nose look higher?
There is a very slight height effect. Now, I usually explain it as about 1 millimeter, but since they are just being pulled together, that alone creates a slight increase in height. However, there is some variation depending on how developed the cartilage is in each person. I usually use dissolvable threads, which take about 2 to 3 months to dissolve. Once a month has passed after surgery, the thread holding the cartilage together is no longer needed, as the cartilage will have adhered and set on its own. There is no reason to use non-dissolvable threads that would remain in the nasal tip, so you can consider them gone after about 2 months, leaving no foreign material in the tip. I have never seen a single case of that. Usually, inflammation or contracture is a matter of whether or not silicone is used. In my personal experience, cartilage tying cannot cause contracture. Hiko is a procedure where a thread is inserted into the nasal tip to pull it up. Since it doesn't involve any actual manipulation of the nasal tip cartilage, it's quite, if you wish, you can have the thread removed and proceed with the cartilage binding procedure. However, if you have had previous nose surgery, cartilage binding is meaningless. If the nasal tip cartilage has already been manipulated, it loses its elasticity and becomes stiff, so binding it is usually pointless. Therefore, cartilage binding is not meaningful for revision surgery, but it is possible if you have had a Hiko procedure. Today we took some time to look at the effects of nasal tip cartilage binding and who it is best suited for. It can be difficult to judge for yourself whether cartilage binding is right for you or if it is the appropriate procedure. Since it often requires an experienced professional to examine you to know for sure, I recommend coming in for a personal consultation if you are curious. I will help you achieve the best possible results. Please like and subscribe. Thank you.